Hi everyone, I'm Ali GREYMOND. Today I'm answering questions about OCD recovery. This is part 2, and this is the questions that you left under my please post a question video. So we will start out with channel members first and then go to the rest of the questions. If you would like to become a channel member, you click the join button and you will be able to sign up from there. And that gives you priority in Q&A as well. So, first question is, Hi Ali, I have joined the channel. I hope you will answer my question. Thank you for joining, by the way. I have three questions. Number one is how do you do ERP for and I'm gonna kind of reiterate here because I don't want to trigger other people with similar OCD, but how do you do ERP for religious OCD? So this is the person is just describing a type of religious OCD, and again, I'm just not saying it because I don't want to trigger other people. So basically, you have to treat any thought that comes in with your theme as it's OCD, whatever you say, I'm choosing to disregard. Of course, yes, the person's asking, is this OCD? Of course, this is OCD. The more you take whatever OCD says seriously, the more intense it will feel. So instead, just say, oh, whatever you want to say, that's fine. Treat it like it's just your next door neighbor saying something and you happen to be overhearing it. Don't read into the content. Just look at it that it's going parallel. Imagine yourself in the car. You're going in one car. OCD with what it's telling you is in the parallel lane. You're not intersecting. You're just going, doing your own thing. And if it's driving next to you, fine. If it went away, came back, whatever, fine. Kind of treat it as irrelevant over there, nothing to do with you. Because that's actually true. It's just autopilot comes in. The reason why this thought comes in is because you're reacting so strongly. So as long as you keep reacting strongly, the thought is going to come in. Your mind, your computer doesn't have any idea why you're reacting to this thought, but it's just sending it to you because you are taking it seriously. So the longer you take it seriously, the more it's gonna send it to you, because it's viewing it that if it's giving you a thought and you're paying attention to it, it must be important because you're treating it as important. Your mind holds on to information that's important to you. So the more you make it important, the more it holds on to it. If you say irrelevant, don't care, after a while it lets it go. And yes, it is OCD. And part 2 is, I'm afraid of death and getting sick, both mine and my relatives. Is this OCD? Yes, it is. And I'm afraid of people. I think that everyone wants to have a quarrel with me. Is this OCD? Yes, it's all OCD. And so we have religious theme. What if something happens in terms of getting sick theme, and what if somebody has a quarrel with you theme. So you're not allowed to ruminate on any one of those themes throughout the day. So going back to what I was saying in the previous Q&A, start tracking how much time you're ruminating on this. Not how much time the thought comes in, but how much time you are responding, and start cutting it down. So if over the course of the day, say the first day you counted, say 400 hours or 400 minutes, okay, that's fine. So then next day, try to go under that in all of these themes. And I strongly suggest including the whole thought process about OCD recovery. Like, am I doing it correctly? What if would I recover? Will I not recover? Blah, blah, blah. This person said this person said that. Because that usually people fall into, especially as they get closer to recovery. They start to kind of go into OCD about OCD, so also included in that. So your 3 themes that you asked me about, plus this, off limits, and if you are ruminating, you're tracking how much time, and you're actively every day reducing. That's your kind of roadmap to recovery. Next question is, Hi Ali, I have one other question. Why do old OCD thoughts come back? Sometimes old OCD thoughts, which became meaningless for me thanks to ERP, pop up in my mind, and I begin to react with fear again after realizing I do ERP, and the fear becomes weaker and goes away. I think it happens because generally you're getting over it, but it seems like you're getting over it to like a 90% so maybe you're working on it just until you start to feel better, but maybe when you start to feel better, you don't really work on it as much. I see this a lot. And then that's why they're coming back. Because really, the process of recovery, it's not like as soon as you feel better, it means that you're recovered. It's as soon as you feel better, it means that now your brain has a chance to heal without you kind of putting it back into OCD. I equate it, if say for example as a child, right? You run, you fall, you scrape your knee, and then you start to kind of pick at the scab, right? As soon as the scab's over, you start to pick at it. Well, when you finally decide to stop picking at the scab, post that, your scab, or your brain in this case, still needs to heal. After you stop, disturbing it, it still needs to heal. And that's kind of the situation here. So, and I think that as soon as you feel better, you think you're healed, you stop doing the recovery work, and then it comes back. So it's kind of like you have to keep on it and kind of expect the thought to every once in a while come in. So I think it's like it's almost healed, but then your brain's like, are you sure? Then say 2 months later, are you sure? And then you start to fall down again because you weren't prepared. So I think there's probably some truth in somewhere in these scenarios. So I kind of gave you a few different ones, so see which one is more sounds like something that you're doing. But at the end of the day, it comes down to how much you're ruminating. That's pretty much all that is. Next question is about moral OCD, scrupulosity. How to do ERP for it? Sometimes I have intrusive thoughts about saying someone, not saying not to saying to someone not the truth. Like I'm assuming lying to somebody in the past, which didn't bother me before I got OCD. Or even if I unintentionally said something wrong about very minor thing, and I realize later after talking it causes anxiety, I can mentally get stuck on it. So you have to look at it as, this would not normally bother me, this wouldn't really bother anybody, it's OCD, it's my theme, anything to do with this. So anything to do with saying a lie before, accidentally, not accidentally, I'm just not analyzing it. I'm kind of taking it all as OCD. So anything that has to do with saying a lie, overall is going to be OCD. And anytime, just like I was saying a few questions ago, right, to another person, right, that anything that has to do with this theme, I'm not paying attention, I'm disregarding, and I'm refusing reaction in every way possible. The more you choose not to give in, the better you're going to feel about this. And just look at it as your theme. This is just my OCD theme. I don't need to pay attention to it. And another very similar question: what to do with anxiety without thoughts? I have ROCD, but after starting recovery work, they come into my mind less, but I still feel the discomfort and anxiety all the time. So because you are worried about feeling anxiety all the time, so before you were worried about your ROCD theme, that generally went away, but now you're worried about the anxiety, and because you're worried about the anxiety, that's where anxiety stays. And it sounds like you've only kind of yeah, so in another comment you're saying, I have a ROCD and I started doing recovery work 2 days ago by myself because of the quarantine, and I started feeling anxiety and discomfort almost all of the time, but before I had time when I felt anxious and the time when I didn't. Was it because I was doing compulsions and now I don't? Is it okay to feel worse after starting doing ERP and disregarding, or am I doing something wrong? Should I go on? So with this, 2 days. So, your recovery is a 6 months process, and during the 6 months with OCD, so you're doing recovery work. You've started. That's brilliant, and expect your OCD to switch themes, because what it's doing right now is it's trying to OCD. So anything that has to do with the recovery process and am I doing this correctly is room in our OCD. I'm assuming you mean relationship OCD, but if you mean religious OCD, makes no difference. With ROCD, right? If it cycles back, again, OCD, disregarding. So both of those thoughts, and 2 days is, I mean, you're gonna have these thoughts for the next few months at least. Kind of give it a much longer time frame. Tried everything I could today in terms of recovery. Yes, okay, great. And not kind of go into as next question is, hi Ali, in pure OCD, is it better to track percent less analyzing each day? Okay, so this is a very good question. You're just recording the time. I mean, you try your best, right? But just day 2, try to do a little bit less than day 1, and day 3 a little goal. Next question is storyline. I mentioned previously I have harm OCD, and then they get a storyline of images of me sitting in jail. Yeah, that's fairly normal. Just how the brain works. It's if you storyline it will come up with. So just if you kind of overhear your brain coming up, nice try, right? But don't actively sit there and, because now that's you actively thinking about it. So if the thought came into your mind, you deal with it the best way. Think about it. Don't sit down and think about it, because that's the worst. Or Googling, that's even worse. Those. Hi Ali, please can you explain how to do ERP for somatic obsession, and breathing in particular? It depends what your overall fear is correctly. And if I'm not breathing correctly, that means what? That you will die. So now that you've identified your worst case scenario, whatever that is, you say, okay, because OCD tells me this, and all the bad things of the world will happen, whatever that is for you. You've been probably controlling your breath for so long, it might feel like you have difficulty breathing. It will normalize itself. You don't need to do anything to kind of say, okay, yeah, I'm just gonna let it be on its own, however it is. I'm just gonna let it breathe however it breathes. Let the body do its job. Making it will feel very scary, but after a while you will start to feel normal every day, doing a little bit more. And another very deal with it, feeling lost. Again, same thing. It's so as soon as you notice it, oh, okay, I noticed it. I don't care. So you're not kind of trying to avoid. Oh, okay, I noticed it. Okay, so what? Like that, kind of giving it no energy. Going back to what I was doing, and you're not trying to control it or change it in any way, and just letting without pushing it anyway. And not ruminating about it. Hi Ali, please give me some information on the recovery process of contamination OCD, because one should do ERP for each and every object in their surroundings. What are the things? Contamination OCD, try to do ERP in a way of, in order to make sure that you're doing response prevention, it has to be, if your target exposure is 10 out of 10, that's not a doable target. Compulsion, whatever the situation is. And since this is a contamination OCD, you're going to do a compulsion. Because on your mental pain threshold of how much discomfort, just a 7 out of 10 max for exposures, no matter what kind of exposure it is, pure O. 10, yeah, it feels really bad, but it's not end of the world bad when you must fix it, right? That feels like too much, do 5 out of 10. With contamination OCD, a lot of but a question of, okay, I'm gonna wash my hands, but just slightly increase that imperfection to the point where you are not doing the compulsion at all. I always focus on hi Ali, if I want something and desire something and I don't assume it have it this instant, my unconscious thought urges into harm OCD. Suddenly I feel how to control it. Please help me. What do I have to do to overcome reassurance and lose faith in life? I know it's like OCD is hard. OCD is hard for everybody. You just bit by little bit, like the person was saying, 5% less rumination. And with this, that creates anxiety. You need to anticipate those thoughts coming in. Start tracking the amount of time you're ruminating and reduce that amount of time. Because when OCD tells autopilot, but how you are responding is you. And that response creates your recovery, and response is what drives you deeper into OCD. Making that choice. And just doing your best, right? That's kind of like a giant push. Just a little bit more. Each day, just a little bit more going forward. But lately I found out about spiritual teachers who talk about emotions and strong thoughts, only see the thoughts. Do you think that a person with OCD should listen to this, and whether it's appropriate? I think that it's okay. Some of it becomes and how it affects you. If you find that it gives you anxiety and you're trying to feel appropriate, it seems like on some level you think that it might be doing some damage to you. So you have two choices. You can listen to it as an exposure exercise, or forget about it for now. I think that the, he has a lot of interesting things to say and a lot of things you can definitely take on board. You go into something that's a very popular trigger OCD thought for a lot of that we do not want to buy into, listen to, get into, because no, just for everybody who's listening to this, if law of attraction is and it does not apply to OCD. You had, say, contamination OCD, then you can definitely listen to something like this. But if would trigger you. But again, it's a good exposure. Can you talk about how one day you can have 10 out of 10 OCD, the next day be complete, you're not compulsing like you were last night, and then panic arrives saying your OCD thought is yuck. Yes, yuck is probably true, right? So, of recovery, okay? So the fact that you're having days when you don't have 10 out of 10 OCD already shows in terms of recovery. So you're one step forward, because otherwise you would be having 10. The problem is that as soon as you start to feel better, you get into another OCD. So, and worrying about why you're not worrying is kind of an intrusive OCD thought. Also, your next door neighbor talking and down this path, right? That, but why? But what is it? One, but then you start to fall into it again, where you could have just said, nope, disregarding, not buying into it, and continue to from a different direction, right? So don't let it. Just see it for what it is. It's just another way of. Next question is how to deal with. Well, I mean, depression, feeling depressed during OCD is normal, right? Then there would be something wrong. Feeling depressed is normal. Just look at it that this is not clear that will pass as the situation resolves itself. So just focus on OCD recovery. That will help to alleviate some of it. And again, this is just track the amount of physical compulsions that you're doing and reduce, because if you see that day 10 I'm doing way less, you can't feel depressed about this, but if you're not tracking it, you might not even really notice it, especially when you're in OCD, right? It's tracking it and seeing that, hey, I'm doing this, I'm overcoming this. Important to go back to normal life after recovery. Next question. Schizophrenia is not an anxiety disorder. No, one cannot. Your chances of within your demographic of the same age and whatever, more likely to develop schizophrenia because you have OCD. One has nothing to do with the other. And in terms to who actually had schizophrenia, so it's, I don't know. In 10 years, I don't even remember, to be honest. So it's very, very rare. So live with that uncertainty a little bit and say, okay, yeah, I'm maybe a little bit uncertain, but feeling the fear and then this question is, okay, this is a very good question. I will never get out. How do I deal with suicidal thoughts from feeling so trapped? So, but what I think happened here is you stuff. This is why I'm doing this channel, is because these little nuances is, you're exactly right, that if you try ERP, put yourself to 10 out of 10, clearly cannot do response. It's chronic, you can never recover, here's pills for life, and that's how it works. For in the previous question, assess what is your level of this. 10 is max that can tolerate. I don't like to go beyond 7 out of 10 when it comes to do max, meaning that 10 out of 10 is the highest anxiety you could possibly have, and 0. If you find that your mental pain threshold is lower, do 3 out of 10, do 4 out of 10 to point B. So from where you are now to full recovery, snail speed towards it, you will still get to, depends on that speed, but you can only do what you can do. A lot of times clients come to me and they're in more problems when it comes to OCD recovery. They make OCD recovery harder, and because of that, you're in, what can you do, so that's just kind of how it is, right? So I can do recovery work. If other people can do recovery work, you can do recovery work. We're just start with a very, very low number. Even like just start with 2 out of 10. Physical compulsions, or even rumination. It down, not as though I'm cutting down this whole entire thing, this whole entire compulsion. More handleable. It's not an all or nothing thing, and just have to choose to disregard them. Just say, you know what, I can overcome this. I'm just gonna do it one step at a, and you just have to keep going. You know, you just videos, and I'm sure people will answer you who are going through exactly the same thing. How do you handle anticipatory anxiety regarding going to the office, facing colleagues? Anxiety. Try to take it as, you know what, it's going to be how it's going to be, because it's this an anticipation that you have to be perfect. That's a mistake. Okay, then I'm going to make a mistake. I'm human, I make mistakes. Then I'm going to make a mistake. My best, and then what happens from that is whatever happened happens. It's an OCD thought that you're ruminating about, so choose not to ruminate about it. That's all the questions I have for today. If you haven't heard an answer to your question, please understand I have, I think, 170 questions. I'm trying to get to as many as I possibly can. If you need more urgent help, I do have the Join program, which is only like for the $5, and also I have the recovery program if you would like to start one-on-one program with me. All that information is available on youhaveocd.com. So for the program, you can sign up there. For the join button, you can just click on the YouTube. So I hope you find my videos helpful. Thank you for watching. I'll see you in continuing Q&A, because I will try to answer as many as I possibly can, but there's just a lot of questions. But I will do part 3 tomorrow.